Dr. Belisle earned her PhD in mind-body medicine from Saybrook University. Her specialization was in integrative mental health. She also has graduate degrees from Columbia University Teachers College, and New York University. She was formerly a social worker and psychotherapist in New York City and pivoted to coaching and trained to become a national board certified health and wellness coach. She provides coaching, wellness events, and yoga through Flexy Wellness LLC. While serving as a researcher, program manager, and development officer for an integrative healthcare center, she contributed to several published research articles on integrative medicine modalities. Her goal is to share safe, ethical, and effective ways for coaches to provide mental well-being support. Take it away, Dr. Belisle. Thank you for being here.
Thank you so much, Dr. Moss, for inviting me to join you today. I'm hoping you can see my slides. Are they
Excellent.
full?
Yeah, we see
Okay,
your title slide.
excellent. Thank you. So yes, it's an honor and a privilege to be here, and I'm just overly grateful for my doctoral journey at Saybrook, which was undoubtedly transformative. The one thing I want to add to my bio is I did just take a psychotherapy job too, which is actually relevant to our discussion today because my conversation is around wellness coaching and integrative mental health care and some addressing the similarities and differences between coaching and therapy. So pivoting one way and then the other has been part of my journey. Here we go. So the title of my dissertation was Health and Wellness Coaching and Mental Well-Being, a Single Exploratory Case Study. Not surprisingly, it is a merging of my different areas of interest, integrative mental health care and integrative wellness coaching. My specialization is integrative mental health care, but I found myself drawn to the wellness coaching model as well. And this topic emerged largely during the pandemic when I noticed, there was such a need for mental health services and there was a lack of available resources. I was working at the time both as a therapist and as a coach. And I found myself wondering, what is the role that health and wellness coaches can play to help alleviate this problematic mental health care resource shortage? But I also recognized it was a potentially controversial topic and that there would have to be quite a bit of nuance in exploring that topic, recognizing that the coaching scope is quite clear and somewhat it's contained. And if coaches were to work in the mental health care landscape, it would have to be with a great degree of care. So wanted to mention that. These are the committee members who supported me, and I will forever remain grateful to Dr. Arcuri, Dr. Heitner, and Dr. Serrato. I learned so much, and I'm very grateful for having had their guidance and support. This is a brief overview of the topics I hope to address in the next 25 minutes. I'll touch upon them as efficiently as I can. So as I mentioned before, we have been facing a problematic mental health resource shortage. As some people may know, that 1 in 5 adults in the US lives with a mental health condition. And while so many people have, live with these challenges, only about half of people with diagnosed mental health conditions actually receive support. I also learned this quite shocking statistic that 150 million people in the US live in a shortage gap area. So designated areas of the US where there is decidedly not enough providers. So the problem certainly got worse during the pandemic, but it persists. You probably have heard people say, I want to find a therapist, I need support, I can't find anybody. It's a very common problem. One of the ways that academics and program managers have sought to address this gap is through there's different ideas. One is this concept of task shifting, which is to shift to shift tasks away from very highly trained providers towards potentially less experienced or trained providers for more milder or less pressing presentations. And this allows for efficiency, as in like a stepped approach. There's many different environments where this model is used. One model that I think is interesting is in the digital mental health landscape. You may have heard of services like Lyra Health, Spring Health, BetterHelp, or Ginger Headspace, where they have like a triage system for aligning a client, or usually a client or patient, with an appropriate level of service. And they work in, there's teams and there's communication between the providers, but there's a sort of stepped approach. So in many different environments, coaches are part of multidisciplinary teams, and it's a model that I think was interesting. So this idea is that there may be coaches, maybe we could call them mental health coaches, that is also potentially controversial, can help fill this gap, but it needs to be approached with caution. For individuals who are not as familiar with health and wellness coaching, I just wanted to provide the tiniest bit of background, which is that health and wellness coaching is like a niche area of the larger coaching landscape, which has sort of blossomed since the 1990s. And health and wellness coaching is newer. It's more in like the past maybe 15 or so years, or 20 years, that it's really started to take off. There are now over 10,000 board certified health and wellness coaches who've been certified by the National Board for Health and Wellness Coaching. And there are these really clear requirements in place for people to become board certified. There's a certain level of training and experience, and they have to pass a board exam. So, but it's an emerging evidence-based practice. There's quite a bit of research to support the benefit of health and wellness coaching for different health concerns, especially chronic illness, but less research on mental health outcomes. So that was something that I was interested in discussing. My study is about scope of practice, partially about scope of practice for coaches. So I thought I would just mention this, show this. Well, what is the scope of practice? So health and wellness coaches work with individuals and groups in a client-centered process to facilitate and empower the client to develop and achieve self-determined goals. So they don't treat or heal. There's no diagnosis. There's no prescribing. It's a partnership and a facilitative process to support a person to work towards goals that are self-determined, that are meaningful to them. So the language really matters. And that was a lot of what I focused on in writing and editing, was like making sure that the language was clear about what coaches do and don't do. So this is a brief overview of my conceptual framework. It is an interdisciplinary study. I had to merge concepts from many different disciplines. We have the coaching psychology domain. There's the wellness paradigm, lifestyle medicine, integrative medicine. And coaching versus therapy is a topic that's really important. So, and here's some key concepts. Excuse me. Oh, just lost my slide. The illness to wellness continuum, I think, is really worth mentioning. That's the concept that health exists on a continuum, and typically people who work in a clinical setting, like therapists, for example, are going to work more in a model of addressing disease, or we've called them disease states, like problematic. Work on pathology. Whereas in the wellness model, we're going to be working towards improving, enhancing well-being, cultivating greater states of well-being. And that is the model in which the health and wellness coaches typically work. So salutogenesis is, I love this word, I don't know why, the cultivation of greater states of well-being. And there's quite a few other concepts I wove in. Mindfulness ends up becoming really important in the study. That was a surprise, but I'll touch upon that later. Okay, coaching versus therapy. In this conversation, describing the differences became really important. And people typically ask, oh, you're the coach and you're a therapist. What's the difference? There are very clear differences. And this is what the literature said before. I ended up validating this with my own research, that these were quite a few of the differences. Therapists will diagnose and treat mental disorders. Coaches do not. Therapists will help heal, including addressing trauma. Coaches typically don't do that. Although we could say that even though coaching isn't therapy, coaching is often therapeutic. And it's a nuance, but it's important. Coaches will find that their work is therapeutic, but that can't be the intention of the work. That would be outside of scope. It would be maybe a nice outcome, but not one that you can expect. Therapy is regulated, whereas coaching is not regulated. Therapists often work on healing the past, whereas coaches will focus on the future. There's quite a few other differences. Again, health and wellness coaching is evidence-based, but again, not so much research in mental health. There's some research, but it's limited. And I was hoping to add to that literature base. Some of the topics that have been addressed in the research base include how patients with chronic illness who experience health and wellness coaching will experience improved psychological well-being. Similarly, patients who have serious mental illness, if they engage in health and wellness coaching, they might improve their lifestyle behaviors, which in turn helps to improve their emotional well-being. College students will experience mental and emotional improvements that help with academic performance and reduce stress. There's a lot of research on veterans, and there's improved psychological well-being. Also employee wellness services and burnout prevention among healthcare providers. So this is the research gap that I was hoping to address. There's a compendium of health and wellness coaching research that I referred to many times. And in that compendium, they called for more research on health and wellness coaching for individuals with what they call neuropsychological concerns. They also asked for qualitative research on coaching practices, so like the qualitative watching what's going on in the room or descriptions of what's actually happening in the space rather than more quantitative research. Also, what I also found was that there's basically no research on coaches who work in private practice, and more than half of coaches do work in private practice, so that's a huge population that really hasn't been addressed. So this is the purpose of my study. The purpose of the single exploratory case study was to explore how national board certified health and wellness coaches, they had to have that designation, addressed their clients' mental health and well-being while navigating the discipline scope of practice. So how do they support their clients when these clients come with mental health concerns? What do they do? But how are they doing it while being mindful of their scope of practice? And these were the research questions. How do they address their clients' mental health and well-being while navigating the scope of practice? That was the primary question. I had sub-questions. How do they describe the similarities and differences between coaching and psychotherapy? I was really interested. Are they proficient in describing these differences and similarities? When they are in the room with these clients who might be experiencing anxiety, stress, or depression, what approaches do they use? What are they doing? Do they have tools that they're using, or do they refer? Then the final question was, how and when do National Board Certified Health and Wellness Coaches collaborate with or refer to licensed mental health professionals when supporting with clients with mental health concerns? So it's very much like exploring the landscape. What do clients do? What do coaches do? And how do they handle these potentially challenging situations? I did case study, and I followed the advice of the practices of Yin, who writes about case study. And one of the things he suggests we do is come up with theoretical propositions. So we come up with what we expect to find based on the conceptual framework and align those with the research questions. So I did that. I will not necessarily read them to you, but it's a way of organizing the research, because qualitative case study can be kind of overwhelming. There's a lot of data. There's a lot of openness to it. It's a way of structuring it. This is a little overview of my methodology, the type of study that I did, how I chose people, the data collection, etc. I'll touch upon that quickly. So again, it's qualitative case study. And I chose this because it's a really useful tool for exploring a phenomenon in depth in its real life context using multiple data sources and methods. So if you have a phenomenon about which that's novel, about which little is known. So this is the experiences of coaches in private practice and what they do in this situation. I was like, well, where do we start? So it's a way of kind of gathering data about the landscape. And then we use multiple data sources to increase rigor. So in my case, I had 3 different data sources, which I will tell you about. So case study, one of the challenges of case study is that we can't necessarily generalize it and say, well, because of this happening with this population, then that will be true for others. We as readers of qualitative of case studies need to sort of make our own conclusions. Like, well, is this apply to me or does this apply to my population? But it's a way to kind of potentially shed light on a larger phenomenon, but you have to kind of make your jump to your own make your own connections. I had my case is a single case, but really it was a purposive sample. So it was like a group of coaches that I was able to recruit, and each coach was an embedded unit of analysis. Okay, so this is my little flyer that I used. I recruited national board certified coaches that helped me to ensure that they met a certain baseline level of experience and qualification. So they had to report having experience working with clients with stress, anxiety, and depression. They had to have, I chose 100+ hours of experience, adults, speak English, and we had to work in private practice. And that was important to me because coaches who work in settings with other practitioners, if other coaches or in a clinical setting, they have the benefit typically of peer consultation, of supervision, of mentorship, and that is not necessarily true for private practice coaches. So they're sometimes possibly having to figure things out for themselves. So I targeted 8 to 10 coaches. I ended up recruiting 12, and 11 finished the study. And I ended up with a couple more because I was looking for data saturation where we start to see where the results start to repeat, where we start to find, the findings start to repeat. Okay. So these are my data collection methods: a questionnaire, an interview, a semi-structured interview, which I had field tested with some volunteers, coach documents, and yeah, those are the 3. And then I put everything in. I had to learn in vivo and put everything in a huge database and code everything. This is my triangulation strategy: interviews, qualitative, questionnaires, and documents. So they would maybe send in like website content or nothing personal about any clients. It would all be about their practice. Like, here's a website or a bio, or here's a handout or an educational flyer. And I would use all this data to figure out, well, what are coaches actually doing? I followed Ian's strategies of describing the case, following theoretical propositions, looking for rival explanations, like things that were not expected, but were rival descriptions of how things happened. And then I did inductive analysis too. And I used Miles Huberman and Saldana's coding methods, iterative coding, coming up with propositions, assertion, kind of going through the data multiple times, finding themes, and then putting them into categories. So, and then I was very careful about the ethics, privacy, etc. Here we go. Let me move here to my results. Okay, so I had 12 participants. 11 finished. Everyone did the questionnaire, 11 did the interview, and then I had all these documents. Interestingly, this was not expected. All of my participants were female. That was interesting. 75 identified as white. 75 were between the ages of 75% were between the ages of 40 and 59. They were all highly educated. All of them were part-time. And there were 2 therapists, and that was useful to me because then I was able to ask that, compare how they responded based on having clinical backgrounds and experience or not. while the sample is quite homogeneous, it's worth noting that the demographics of this sample are quite similar to the demographics of a survey of national board certified health and wellness coaches that was completed. So that was kind of interesting. They all had different practice backgrounds, but they all focused on stress management and mental health. And so here's what I found. How much time do I have? Like 10 minutes or so? Okay. So everything's organized by research question. I'm going to go through it real quickly. How do national board certified health and wellness coaches address their clients' mental health and well-being? Navigating this is about scope of practice. How do they stay in scope? So these are the 4 things. They stay in scope with a wellness promotion orientation. They know they're not there to treat disease or diagnose. They are there to promote well-being, and that's one way they stay in scope. Another way they stay in scope is to clearly define their roles and define their roles and use contracts and describe it in writing and in conversation. They engage in ongoing evaluation of client fitness for coaching, and that can be kind of about intuition. I'll get into that in a minute. And then they use mindfulness to navigate gray areas. So these are 4 strategies that came up repeatedly about how they are careful to stay in scope. So again, there's this adherence to a wellness orientation, not prescribing or treating, but rather helping them feel amazing and full of joy and focusing on well-being. Okay, that's really key. Then putting everything in writing and having conversations about what their roles are and what their roles are not, and making sure that it's a good fit. Like, oh, what do you need? Is it what I provide? If it's not, they would refer out. They also this whole fitness for coaching idea, like what's the energy appearance? Are they showing up with a mental health goal? That would be a red flag that maybe it's not the right fit. Oftentimes clients were asked to identify, disclose if they're in mental health treatment. Sometimes they would, or sometimes they would not. This is really big. If the client is able to take action towards goals, that is a sign that that's coachability. If a client can't move forward after repeated sessions, maybe the client needs other support, maybe therapy or something else. So those were ways they helped to discern if they're staying in scope or not. They use mindfulness as a navigational tool. Several times described their felt sense, slowing down, pausing, things like that. And then they were careful not to dig into trauma-related terrain intentionally. Trauma might come up, but they don't dig into it. If it's a gray area, if trauma is comes up, that would be considered a gray area. Okay, sub-question number 1 about similarities and differences. I have a list of what they came up with, which is quite similar to what was in the literature. Similarities, exploring emotions. This is between coaching and therapy. Exploring emotions, empathic relationships, ethical commitment, adherence, holding space, having meaningful conversations, using mindfulness, and similar theories of change. But these are the differences. Coaching is going to be goal-oriented, whereas therapy is about processing emotions. Therapy is going to be maybe more expert-led, whereas coaching is more client-centered or client-led. Coaching, these are generalizations. That's not true for every therapist or coach, but this is patterns. Goal orientation versus healing the past, clinical versus non-clinical. Here's a little image a little Venn diagram of similarities in the middle and differences on the side. And if you are interested in this, I can send it to you. And this is very similar to what's in the literature, but it's validating to see it come up again, right? Sub-question 2, what do they do in the room? When a client shows up and they have a anxiety, depression, or stress concern, what are they doing? Okay. The key thing they have to offer is partnership and a safe space, being an ally, being a collaborator. Their role, they see their role as supporting and empowering the client. That's like number 1. They support mental well-being through empathy, holding space, creating a supportive environment, using mindfulness. And this comes up in many different ways. They might use mindfulness skills in the room if they're trained to do so and with permission of the client. Or maybe they use it for themselves to stay really centered and focused. Or maybe they use it to navigate gray spaces. They also will just be there as a support, advocacy, cheerleading, encouragement. Sometimes people need more social support. Um, and then there's connecting clients to clinical care. So let's say a person, oh, I'm stressed, I'm anxious. The Then we come with those concerns. A therapist would dig in. The coach might say, well, how do you want to address this? Maybe we should find appropriate care for you. And they would use the coaching space as a way to connect a client to appropriate care. And then if the person already has a therapist or other support, they can use the coaching space to help the client follow through on the clinical recommendations. So they're not making the clinical recommendations, but they might help the client follow through on the clinical recommendations. They can, if they have training in this, which many of these participants did, they might teach emotional regulation skills with the client's permission. Maybe they'll teach some stress management skills, coping skills. Again, it's based on whether they have those certifications and are, speaking about it from a place of expertise, not, oh, I learned this, in a book or whatever. They have to really know what they're doing. They might do that. And then you would use typically core coaching skills, motivational interviewing, positive psychology, breaking large goals into small steps. And lifestyle medicine is a big one that many coaches, health and wellness coaches typically are educated in lifestyle medicine principles using sleep, physical activity, nutrition, stress management, relationships, avoidance of substance use. And they would use awareness of these concepts to have discussions about how lifestyle medicine can support mental well-being. The third one was about coaching approaches in terms of making referrals and connecting clients to licensed providers. They use the coach approach to guide referrals. So instead of saying, um, here's a recommendation, I want you to talk to this person, they'll bring it up more like, how do we, you've talked about how you're looking for some additional support. How can we go about finding that for you? Where might you find some resources? If you'd like, I can offer some, but it's up to you to choose the ones that you want. It's like using a coach approach, asking questions, that kind of thing. And then maybe the pursuit of mental health care will become a client's coaching goal if they want it to be. I found that collaboration is rare between coaches and therapists, even though clients sometimes want it. I also found that many coaches do obtain consultations on challenging cases, and sometimes coaching and therapy co-occur, although the communication between the providers is quite limited from what I've witnessed. That may not be true always, especially if in private practice. If it's in an organizational setting, I think there might be more collaboration. Through inductive analysis, I found these 4 things. Coaches really could benefit from more supervision and support. They often will need more mental health training, especially mental health first aid training. Many of the coaches felt that they or other certified coaches could help fill the care gap, especially with supervision, mentorship, and mental health training. And I also found that coaching informs therapy and could be a skill set of therapy. So I mentioned earlier that I'm returning to work as a therapist, and I'm going to be doing so having really absorbed all of these principles from coaching and weaving it more explicitly into my therapy practice. So really focusing on client empowerment, unconditional positive regard, which should be given anyway, but really trying not to pathologize, focusing more on strengths. I'm excited to return to my practice, really bringing all of these tools from coaching into it, but within the domain of a clinical model, which allows me to do more. Okay, so this is a description of coaching-informed therapy. And so practice implications, I will go through those really quickly. Where are we? Here we go. Practice implications. Coaches should clearly communicate roles and scope. They should be able to explain coaching versus therapy, focus on strong partnerships and effective coaching presence. Uh, Mindfulness could be a useful tool. Building a resource list, having one on hand, but really using the coach approach to engage that resource list, pursuing additional mental health training, obtaining supervision or mentorship, focusing on wellness promotion versus disease treatment, so focusing on salutogenesis, learning about lifestyle medicine and mind-body practices. These can all be really effective ways for coaches to offer support while remaining within scope. So that is my presentation, and I do hope more research happens in this area, especially qualitative research, maybe outcomes research comparing coaching and therapy. And I would particularly be interested in a Delphi study where we gain consensus among a panel of expert coaches on how best to guide coaches, especially private practice coaches, on this topic. So that is it. And I am happy to answer any questions.
Thank you